Chepur from Mallareddy University. Firstly, I'd like to take this stage to thank the organizing committee here at NIMS for providing me this opportunity, and also a movement for the legacy of Professor KAKARLA Subbarao garu for his immense contributions to the field of radiology. Today, here I present a topic, occupational health challenges in radiography, with a special emphasis on work-related musculoskeletal disorders. So the core objectives of this presentation are fourfold. First of all, we'll have an overview of what occupational health challenges mean. We'll be defining what does work-related musculoskeletal disorder mean, and also discuss some ergonomics, some risk factors, and some of the ignored qualities like depersonalization effects. And also to propose certain interventions which are scientific based and which might help the radiographer to avoid these work-related musculoskeletal disorders. Ironically speaking, even Subbarao garu had worked a lot on musculoskeletal radiography, so we are all inspired by him, even myself. So coming on to the presentation, we have to define work-related musculoskeletal disorder. These are nothing but the injuries to the nerves, tendons, cartilages, and also spinal discs that are caused due to repetitive work over time. And we should also, there's also this to mention that this is a chronic condition, not acute, which means it develops over time. We could see a very high prevalence rate of 70 to 95% according to some research studies, and thus it should not be ignored. So we can classify the symptoms of these musculoskeletal disorders into two broad categories. One being the repetitive strain injury, which means it is caused due to repeated motions over time, and also which causes the symptoms of pain, tingling, numbness, and also a reduced range of motion. Some of the associated conditions include carpal tunnel syndrome, cubital tunnel syndrome, tenosynovitis, tendinitis, etc. And also the overuse syndrome, which is actually a very gradual process which causes a gradual wear and tear of the muscles and connective tissue due to excessive use. Symptoms include stiffness and swelling primarily. Associated conditions include back strain, sprain, disc herniations, and also rotator cuff syndrome of the shoulder. If you see the overall prevalence, research studies suggest, I have taken 14 research studies out of which suggest that there is an 85% prevalence with a confidence interval of 74 to 95% among 12 months, first 12 months of the radiographer journey. And also it does not only impact the health, physical health, but also it leads to high absenteeism. Also it is linked to a lot of stress, and also affects the diagnostic accuracy. If you see by the anatomical region, we could see that there is a lot of neck and a lower back complaints. The prevalence of neck being 73% pooled, and also the lower back which is around 67.4%. Apart from that, we have other parts of the body such as the shoulders, upper back, wrists, ankles, and also the feet. Here we could see the depiction of few of the syndromes. The first one being the neck pain, tenosynovitis, which affects the ligaments of the wrist, affecting the thumb movement. Also the ankle, the rotator cuff, impingement, sometimes shoulder impingement cases come in MRI. We could see the upper back pain, which is the trapezius muscle, and we could see various back issues such as disc herniation, disc bulging, etc. If you see the risk factors, the first and the foremost being the physical, which comes from an awkward posture, and also physical force that is required on a daily basis of a radiographer's job. Also some psychosocial elements such as anxiety and also stress are interlinked to this. If you see the demographics, it is noted that female radiographers and young radiographers have complained a lot in recent years. So these are the basic ergonomics in radiography console room that everyone must follow, not only specific to radiography, but also to different fields, whereas armchair provides supports for the lumbar support, and also the full length of the thigh should be covered. The distance from the monitor, the elbow position, all these play an important role. These are very minute changes, but they can help a lot. These are again the risk factors. Coming on to depersonalization disorder, this is very often neglected syndrome that no one talks about. It is defined as talking to oneself, observing one's own thoughts as a third person, and which has a prevalence of up to 17.2% among radiographers, and also even much more in radiologists, 53.3% is that we see. This is caused due to very high stress environments over time, and also it exacerbates the musculoskeletal disorders that are already existing in the radiographers. If we see some of the other occupational challenges, it includes burnout, which contributes to around 30%, fatigue and sleep disturbances due to shifts, night shifts, changing of the shifts. Also the MRI fields, poor quality of life was observed in females and older workers. If we see some interventions which I have mentioned here, I have listed 4 interventions. First one being optimization. We could have workstations which are adjustables, we could have micro breaks, and also patient transfer devices which reduces the need for radiographer to strain a lot. Psychosocial support includes having stress training, mentoring programs, and also counseling services. Workforce relocation includes roster services, also non-clinical task delegation, so that there is a balance between clinical and non-clinical delegations. Finally, health policy reforms which could be brought at a state and a national level, such as improving the standards, protocols, etc. If we have done these interventions, we can pitch to about 60 to 70% of risk reduction in the work-related musculoskeletal disorders overall. I would personally recommend a future recommendation from my end. It would be having a workload balance, mental health support, and also better ergonomics, which is not discussed everyday basis. Flexible scheduling and also assistive technologies that could be used by the radiographers, radiologists, and the assisting staff. These are the references that I have taken from. Thank you very much.